Hello, I'm Pierce Nunley. I'm a spine surgeon from Shreveport, Louisiana at the Spine Institute of Louisiana. Disc arthroplasty has been something that we've been doing at the Spine Institute of Louisiana for about 8 or 9 years. The Mobi-C study came to us when we were actively involved in other TDR projects, and we looked at the implant. It was actually quite interesting because it was an implant that was different than other implants that were on the market. One of the more interesting aspects and actually nice aspects of Mobi-C is its simplicity of use. The fact that essentially you don't have to cut keels and be locked into that kind of environment is actually quite helpful. So the nice thing about this implant is it allows us to kind of fine-tune it without having to be locked into a specific position. One of the most exciting things about the fact that we had a two-level arm to this study is that it really gives us real data on what does a two-level do. And one of the neat things about this is that the company actually went, as a separate study in and of itself, and the company actually invested in let's study this and let's get good data. So we have good, medium term at this point, data that shows how two levels do. We have superiority on the clinical outcomes, and we have a significant difference in the reoperation rate between ACDF and total disc replacement is really quite compelling. When data is equivocal, you can play all sorts of games in your mind about how that's going to work out. But when you get superior data, and it's class 1 data, and it's just compelling at that point that a doctor has to go, gee, if it were me and I had this problem, what would I choose? The fact that we have an on-label two-level indication for this device gives us the data to know that if we implant this versus an ACDF, we are likely to get a better outcome. There's several patients that we've operated on that we really have some amazing successes with. One that comes to mind is a opera singer who's a soprano, and she's amazing. She's a professional opera singer, and she came to me with a two-level problem and had been having pain for an extended period of time, and it was really affecting her ability to even sing, her ability to be able to sleep, and that was affecting her life professionally. I talked to her about doing both either a standard ACF with a plate or doing the Mobi-C study, and she opted for that, and she did extremely well. And I got to see her perform afterwards. So I mean, it's really fun to be able to intervene and help somebody with this kind of problem and use this technology. Patients that really come in, they want the new technology. They don't want to have fusion. They don't want to stop motion in their neck. Cervical total disc replacement is here, and it's here to stay, and it has a very excellent place in the treatment of cervical disorders.